Right now, sit on a hard chair. Shift your weight until you feel 2 bony points. Those are your ischial tuberosities. Most people know them simply as your sit bones. In this exact position, your L5-S1 disc is enduring approximately 150 pounds of pressure. That pressure is per square inch. It is a concentrated force acting on a tiny hinge. You feel a dull ache. You call it a muscle knot. You think it is just tension. But the biology tells a different story. This is not a simple problem of tight muscles. This is a structural failure. Your pelvis has lost its ability to act as a shock absorber. Think of your pelvis as a dynamic cradle. It should distribute weight across your entire frame. When it misaligns, the cradle tips. The weight shifts from bone to soft, vulnerable spinal discs. Your L5-S1 joint becomes the primary anchor for your entire upper body's mass and gravity. This 60-second calibration isn't about stretching. It is about restoring the mechanical leverage of your skeleton. We are going to recalibrate the way your spine interacts with the earth through your seat. Feel the hard surface beneath you. That resistance is the first data point in our diagnostic. Your brain is receiving signals from mechanoreceptors embedded deep within your gluteal fascia and bone. These sensors are screaming. They are reporting a lack of symmetry in your seated foundation. Think of your pelvis not as a bowl, but as a sophisticated architectural bridge spanning your legs. At the very center of this bridge sits the sacrum, the keystone holding the entire structure together. This is the Gothic arch of human biology, where gravity is converted into stability through sheer geometry. Anatomists call this form closure. The wedge-shaped sacrum fits perfectly into the grooves of the ilium bones. When you stand, your body weight drives the sacrum deeper into this wedge, locking the joint tight. But for the spine to remain healthy, this joint must allow for a small, critical rotation called nutation. We are talking about a rotation of just a few degrees within the pelvic ring. This small rotation is what allows your lumbar spine to decompress and absorb the shock of every step. However, when the soft tissues surrounding this keystone become rigid, the nutation is effectively frozen. Without that tiny rotation, the shock of movement cannot be absorbed by the pelvis and moves upward instead. Your lower back is now forced to compensate for a job it was never designed to handle alone. That persistent, dull ache you feel is the result of this redirected mechanical pressure on the spinal structures. To fix the back, we must first restore the small nutation to the sacral keystone. Deep within the abdominal cavity, a hidden biological bridge dictates the entire curvature of your lower spine. This is the iliopsoas, composed of the psoas major and iliacus, the primary muscular architecture that physically links your upper torso to your lower limbs. The psoas major attaches to the sides of your T12 to L5 vertebrae and the intervertebral discs, while the iliacus attaches to the inner surface of the ilium. Both converge to insert on the lesser trochanter of the femur. Imagine multiple cables originating from the very core of your back, diving through the pelvis to the femur. When you sit for prolonged periods, these muscles remain in a shortened position, which can lead to adaptive shortening over time. Over years, the muscle tissue adapts, physically shortening and losing the elastic capacity to fully lengthen when standing. Now, when you stand up, this shortened muscle acts like a tightened bowstring, pulling the lumbar spine forward and increasing the arch in your lower back. It relentlessly pulls your lumbar vertebrae forward, creating an exaggerated lordosis in your lower back. This exaggerated lordosis isn't a bone problem. It is a structural failure of this internal tensioning system. As the spine pulls forward, the pelvis tilts anteriorly, increasing the forward tilt of the pelvis. This triggers a muscular imbalance where the hip flexors become dominant and the glutes may become inhibited, according to a theoretical model of reciprocal inhibition. Your gluteus maximus, the body's most powerful stabilizer, may become neurologically inhibited, a concept known as gluteal amnesia, leaving you vulnerable. The result is a mechanical trap where the back muscles must overwork to prevent you from falling forward. Every step you take becomes a battle between a tight front and a weak, overstretched back. To reset this, we must target the specific neurological junction where the psoas meets the lesser trochanter. We are not just stretching a muscle. We are recalibrating the tension of the primary bridge of human movement. Now, look behind you. Beyond the muscles sits a structure far more sophisticated than simple contractile tissue. This is the thoracolumbar fascia, a multi-layered diamond of connective tissue that functions as your body's pressurized suit. It is a hydraulic amplifier designed to turn the internal pressure of your core into structural spinal stability. When your pelvis is neutral, this fascia maintains what biomechanics call hoop tension, a circular, reinforcing grip. But tip the pelvis forward, and that tension collapses. The pressurized suit goes slack, leaving your vertebrae vulnerable. Decades of research into the spinal engine theory reveal that our traditional understanding of movement is fundamentally backwards. We often assume our back muscles move our legs, but the reality is that the pelvis moves the spine. The pelvis acts as the primary driver, using fascial tensioning to store and release energy like a massive spring. By resetting the pelvic angle in 60 seconds, you aren't just stretching, you are repressurizing this hydraulic system. Once the hoop tension is restored, the fascia can once again bear the load that your muscles cannot. This shift moves the burden of gravity away from your sensitive discs and onto your resilient connective architecture. The stiffness you feel is often just the fascia screaming for the tension it needs to function correctly. Think of it as tightening the laces on a high-performance brace that you were born with. This creates a rigid cylinder of support that protects your lower back during every twist and every step. Every degree of pelvic correction ripples upward, recalibrating the entire kinetic chain from the sacrum to the skull. Now that we understand the hydraulic nature of your back, we can apply the precise mechanical correction required. But there is a deeper layer, a neurological circuit, that connects your emotional state to your physical posture. Deep within your core, the psoas muscle acts as a direct messenger for the sympathetic nervous system. When your amygdala senses a threat, it triggers a primitive reflex to curl your body into protection. This fight-or-flight response immediately shortens the psoas, pulling your knees toward your chest for safety. In our modern world, chronic stress keeps this signal active, leaving your pelvis in a state of guarding. This creates a protective co-contraction, where every muscle around your spine locks down to prevent any movement. Your brain isn't locking your back because it's damaged, it's locking it because it perceives instability. This is a software error in your nervous system, a feedback loop that refuses to let muscles relax. To understand why this persists, we must look at the sensitivity of the gamma motor neurons. These specialized neurons set the tension thermostat for your muscles, determining how much they resist a stretch. This is why traditional stretching often fails. The brain interprets the stretch as another threat to stability. If the gamma motor neurons are oversensitized, the muscle spindle will snap back like a tight rubber band. You aren't fighting tight tissue. You are fighting a nervous system that has forgotten how to feel safe. To release the back, we don't pull the muscle. We must recalibrate the signal at the source. We need to convince the brain that the spine is stable so it can finally unlock the psoas. Now we perform the 60-second reset. This is not a stretch, but a high-speed neurological override of your posture. We utilize a physiological phenomenon called reciprocal inhibition. When you contract one muscle, its functional opposite must relax. By engaging the hip adductors and abductors isometrically, we send a direct command to the overactive lumbar muscles. Inside your tendons, specialized sensors called Golgi tendon organs monitor this tension, acting like biological circuit breakers. When these organs detect a sustained, safe contraction, they force the nervous system to drop its protective guarding. Think of this as a software reboot. We are clearing the corrupted data, causing your chronic lower back stiffness. Place a firm object between your knees. Squeeze inward with 50% effort, holding the tension for 10 seconds. Immediately after, place your hands on the outside of your thighs and push outward, maintaining that same steady pressure. This alternating tension creates a rhythmic oscillation in the pelvis, recalibrating the tension between the front and back. The spinal cord receives this input and begins down-regulating the firing rate of the paraspinal muscles almost instantly. You are essentially blinding the brain to its own perceived threat, allowing the psoas to finally let go. During these 60 seconds, the chemical environment at the neuromuscular junction shifts from excitation to a state of recovery. This is the lumbopelvic rhythm being restored. The pelvis stops acting like a locked hinge and becomes fluid again. Feel the heat generating in the deep hip. That is the sound of your internal bracing system finally disarming. 60 seconds of precision. No sweat, no straining, just pure calculated physiology rewriting your relationship with gravity and movement. This physiological shift isn't just a feeling. It is the clinical validation of Andrew Vleeming's landmark research. At Erasmus University, Vleeming mapped the precise mechanics of what we now call the force closure mechanism. Think of your sacroiliac joint not as a static block, but as a vault requiring active compression. Vleeming identified a massive crossbody network known as the posterior oblique sling, a biological X shape across your back. This sling connects your large latissimus dorsi muscle on one side to the opposite gluteus maximus muscle. When these two giants contract, they pull tight on the thick, diamond-shaped sheet of the thoracolumbar fascia. This tension creates a high-pressure clamp, securing the pelvis with a force that bone alone cannot provide. Vleeming's measurements showed that without this muscular stiffness, the SI joint loses nearly 80% of stability. He distinguished between form closure, the shape of the bones, and force closure, the active muscular recruitment. Your chronic back stiffness is often a desperate, inefficient attempt by small muscles to mimic this force. The 60-second reset you just performed re-engages this massive sling, allowing the small, exhausted muscles to relax. It's like tightening the cables on a suspension bridge after years of letting the concrete take the load. Clinical data confirms that this specific cross-tension reduces shear force on the L5-S1 vertebrae by significant margins. The result is a pelvis that is stiff in its architecture, but fluid and painless in its movement. Science proves that back health is a byproduct of how well your shoulders and hips talk to each other. To understand why this 60-second reset works, we must look back to the mid-20th century. A brilliant neurologist began noticing something that traditional orthopedic surgeons were completely overlooking in their patients. He observed that back pain wasn't just about damaged discs or weak, isolated muscle groups. It was a failure of the nervous system to coordinate the complex dance of the pelvis. This researcher discovered that the brain prioritizes global movement patterns over the strength of any single muscle. He identified a predictable pattern of dysfunction that he eventually termed the lower cross syndrome. Imagine an X drawn across your side, where tight muscles and weak muscles create a tug-of-war. On one line of the X, the hip flexors and lower back extensors become chronically overactive. On the intersecting line, the abdominal wall and the gluteal muscles become neurologically inhibited and sleepy. This creates a permanent tilt in the pelvis, forcing the lower spine into a painful, compressed arch. Traditional medicine focused on the site of the pain, the spine, rather than the source of the pull. This shift from structural anatomy to functional neurology was a revolution that the medical establishment initially ignored. He proved that you cannot fix a software problem by simply operating on the hardware of the bone. The reset you are performing is the clinical application of this 20th century breakthrough in movement science. It forces the brain to release the tight line and re-engage the weak line of that X. By doing so, you are not just stretching, you are rewiring the way your brain holds your spine. This rewiring culminates in a convergence at your core, where the diaphragm finally finds its full range of motion. When your pelvis is tilted forward, the diaphragm is physically blocked, unable to descend into the abdominal cavity. But as you reset the pelvic angle, you clear the path for this massive muscular piston to drop. This descent creates what clinicians call intra-abdominal pressure, a force that stabilizes you from the very center out. Think of this pressure as an internal airbag, inflating with every breath to brace your lumbar spine internally. Unlike a back brace worn on the outside, this biological airbag supports the vertebrae from the anterior side. The diaphragm and the pelvic floor now work in perfect synchrony, forming the top and bottom of a canister. This canister effect is the secret to why the back stiffness vanishes. The muscles finally stop overworking. But the implications go deeper than mechanics, reaching into the pathway of the vagus nerve itself. As the diaphragm moves freely, it gently stimulates the vagal fibers passing through the esophageal hiatus. This mechanical stimulation sends a signal to your brainstem that the structural threat has finally been resolved. Your body interprets a locked, tilted pelvis as a state of constant, low-level physiological alarm. By resolving this structural stress, you trigger a measurable drop in systemic cortisol levels across your bloodstream. The 60-second reset is not just a postural fix, it is a neurological off switch for chronic stress. You are moving from a state of structural panic into one of deep, pressurized biological stability. The back pain was merely the symptom of a system that had forgotten how to breathe under pressure. Now, with the canister sealed and the pressure equalized, your spine is finally free to move again. Sit back down now. Locate those two bony anchors, your ischial tuberosities, pressing firmly into the chair. Notice the shift. The familiar grinding tension in your lumbar fascia has been replaced by a quiet, centered lightness. Your spine is not a fragile stack of porcelain plates waiting for the slightest movement to shatter or slip. It is a masterpiece of tensegrity, a biological suspension bridge where every ligament and muscle shares the load. When the pelvis is aligned, the system becomes self-correcting, absorbing impact through fluid dynamics rather than rigid resistance. That chronic stiffness was never a defect or a sign of age. It was your body's protective bracing mechanism. Your nervous system was shouting for a better foundation, locking down the joints to prevent a structural collapse. In 60 seconds, you provided that foundation. You signaled to the brainstem that the structural crisis is over. The psoas relaxes. The quadratus lumborum releases its grip. The intrinsic stabilizers of your core take the lead. Feel the newfound fluidity. Your vertebrae are no longer grinding. They are floating on a cushion of intra-abdominal pressure. This is the resilient architecture you were born with, restored through a simple recalibration of your internal pressure. The stiffness is gone. The foundation is set. Your body is finally ready to move as it was designed.